Hello and welcome to Planet Outlook. For several weeks now, Delhi and several parts of northern India is covered with toxic air. On the onset of every winter, we discuss air pollution. It's becoming a health hazard to our lives. And to talk on this, we have a very special guest, one of the leading voices in the world on the subject of air pollution. Thank you, Dr. Maria Neira. She is the Director of Public Health, Environment and Social Determinants of Health at the Health Department at the WHO, the World Health Organization, as you know. Thank you so much, Dr. Neira, for joining us on Planet Outlook.
My pleasure. Thank you for inviting me.
So to begin with, Dr. Maria, over time, if you could tell us to our viewers how air pollution affects our health, especially some reports suggest that the life expectancy of all of us are going down quite a bit. And you have been a great advocate on the air pollution subject. So just give us an overall picture as you see it right now.
Thank you. Let me tell you that the picture is not very positive. It's a very dramatic one because every year we have 7 million premature deaths caused by exposure to air pollution, to toxic air, what we call in WHO the silent killer, because it's something that sometimes you cannot see. In places like New Delhi, I'm afraid these days you can even see it. But it's definitely one of the biggest killers that the humanity is facing at the moment. And as I say, it represents a totally unacceptable number of deaths every year, together with a lot of chronic diseases that are affecting millions around the world. Is the most important environmental risk factor for health, and definitely the one that will represent a decrease on our life expectancy. And therefore, we are very much concerned about the issue of air pollution. Yeah.
So how does, when we talk about air pollution, we also talk about particulate matter. So if you could tell us how particulate matter kind of affects on the respiratory systems and other parts of it, what damages kind of does it do as a doctor? How do you kind of see it?
Yeah, I think that there is something that we cannot stop doing, which is breathing. So we need to breathe, and we need to breathe permanently, and nobody can escape that. So we are breathing the air that is around us. Imagine that air, which is polluted and containing those very teeny particles, the PM 2.5, which are really, really small. When we take a breath, it goes to our lungs and already cause a damage there, because it will cause diseases like pneumonia, or it will cause chronic respiratory diseases, obstructive chronic pulmonary diseases, lung cancer if you are exposed for a long time, and diseases like asthma that I'm sure that people will recognize very well. Those teeny particles will not only stay in the lungs, unfortunately, they will be able to move to our bloodstream, and from there they can reach any organ. So essentially, there will be a massive damage as well in our cardiovascular system. So it will be responsible for ischemic heart disease and problems related to our heart, and it will reach our brain as well, and it will be responsible for stroke. So imagine such a teeny toxic poison coming into our body and being able to go everywhere, including the placenta. They can cross the placenta barrier and affect the development of the baby that didn't take yet a breath, and is already, the neurodevelopment will be already affected. So it's really a toxic poison that is responsible for an incredible damage to our body.
Dr. Maria, the WHO had set very clear guidelines on particulate matter and other emission kind of standards, but none of the countries are being able to follow, as I see. Each country has a kind of a watered down standard in reference to the WHO guidelines. For example, India's PM 2.5 standards are almost 4 times the prescribed WHO guidelines. Now, on November 10th, uh, Delhi recorded the worst air day kind of thing, and most of North India is kind of grappling with toxic air. When I look at the PM 2.5 levels in Delhi, it's like way above 450 on a daily average kind of thing, 400 plus to 450. How do you react to this? How dangerous is this?
Yeah, as you rightly say, WHO has standards that are the ones recommended to protect or minimize the risk caused by air pollution. And in fact, at the moment, there are only really few countries that are respecting those standards and complying with. The rest of the countries, rather, they do not have standards at all, or they have standards that are beyond the ones recommended by WHO. But even the worst thing here is that even if some countries, they have their own standards, more flexible than the one recommended by WHO, even those standards are not respected. And it's the case that you have described now. We have several periods over the year where many countries around the world, they go far beyond even the national standards, which are less restrictive than the one recommended by WHO. So our concern is that at the moment we are talking, 90% of the global population, particularly those living in cities, in very populated urban areas, they are breathing air that is not convenient for their health, is not good for their health, is putting their health at risk. And this is something that we need to change. We ask countries to accelerate their ambition to reach those targets. First, the targets that themselves they are proposing, and then, of course, in WHO, we will be behind to push for even more ambitious targets that will and recommend standards that will protect people's health.
What are the action points required to kind of come to at least one of the targets? What do you think are the steps needed to come to this?
I think the most important one will be politically acceptance of the fact that air pollution is an issue, is a huge issue for public health, for the economy of a country, and for the development of a country. Unless we do not recognize the urgency of tackling the causes of air pollution and climate change, because sometimes they overlap, I think we will not advance much. Second, we need to do an estimation of the number of deaths caused by the exposure to air pollution country by country. We have the tools, this can be done, this information exists already. So you need to realize not only the impact on the health of the people in terms of mortality, but as well in terms of diseases that are chronic diseases that are costing a fortune to your health system. So when you see that cost, then you see that investments on preventing that will be the trade-off will be so beneficial for the economy of the country and of course to the health of the country. So the first will be this acceptance and the political to scale up action. And the second, the critical one will be to move on stopping the use, stop burning fossil fuels. I mean, we need to all move to a different market shift. We need to go on sustainable, renewable sources of energy. This is a good investment for the economy of a country. It's wrong to say that we are not doing it because it's very, it will represent a big investment and it will slow the economic growth. Not at all. At the contrary, we have well-demonstrated arguments that prove that not only you protect the health of the people, but you invest on something that will be good for your economy. The proof is that the Scandinavians, they are among the richest countries and definitely they have been moving into renewable sources of energy for a long time now.
You mentioned the link between air pollution and climate change. If you can tell us a bit more on this.
Well, it's on a very simple way. I mean, the cause of climate change and the causes of air pollution, sometimes they overlap because it's very relevant to the issue of burning fossil fuels. Once again, there is an overlap between the causes of the change and the causes of air pollution. And this is the burning of fossil fuels. Burning fossil fuels will contribute to air pollution and contribute to the global warming. So if you tackle that, if you change that, you are generating plenty of benefits for your health, for your economy, for your fighting climate change, fighting air pollution. So there will be only benefits. And it's a very wise investment that it has proved that from an economic point of view, plenty of arguments. I'm insisting on the economic argument because I know that for politicians, this is something that obviously they are very concerned about it. But here we have a very good case for economic development as well, not only for protecting people's health.
Dr. Neira, in Paris in COP25, India was actually ranked 9th in the Climate Change Performance Index. However, this year during the nationwide lockdown due to the pandemic, India opened up its coal blocks to boost economic development. How do you react? I know this is a little political question, but is this the right way kind of thing to go back to coal in such a big way?
I think, I mean, from a public health point of view, burning coal is a bad decision from a public health point of view. We have plenty of evidence regarding how negative this could be and how much harm it can cause to public health. But in addition to that, politically speaking, I think as well that this is not their road towards sustainable development, the road to fighting the causes of climate change, and the road to make sure that India or any other country will have a very, a development that will benefit the whole society. That's why for us, this healthy energy transition needs to be done, and is one of the main recommendations we are making on what is called the WHO's Manifesto for a Healthy and Green Recovery, where we insist that if we need to learn something from this terrible pandemic that we are all suffering now, is that we need to change the sources of energy we are using. We need to change the way we interact with our ecosystems. And if we don't learn this lesson now, means that maybe air pollution is affecting our brain and we are less intelligent. And that's why we are not taking the right decisions.
There is also a very sinister link between COVID and air pollution. So should air pollution be treated as a national emergency? What is your prescription right now?
Well, our prescription is imagine that, COVID-19 is a respiratory disease. If you live on a city, on a place where you have been for years exposed to air pollution, your lungs will be more vulnerable to any respiratory disease, including the one caused by the SARS-CoV-2. So obviously, the exposure to air pollution will increase vulnerability of patients to develop the disease. Plus, if they develop it, there will be more susceptible to develop a very severe symptoms and even die from it. We have several papers now published attributing a percentage of the mortality caused by COVID-19 to the association with air pollution. And I think this is something that, again, if we needed yet another argument why we need to act quickly on reducing, on tackling the causes of air pollution, here is one as well. You cannot fight against respiratory diseases with pandemic potential if we do not address the risk factors like tobacco or air pollution. So this is a critical issue that needs to be addressed as a national emergency.
Also, in the entire discussion on air pollution, especially in India, we're always talking about the outdoor air quality. There is very less kind of discussions on indoor air quality. So, a lot of studies have pointed out that maybe the indoor air is kind of more poisonous than the outdoor air. So if you can tell our viewers a bit on the indoor air quality and how one can basically take steps to kind of combat indoor air
Yeah, definitely indoor air pollution represents a major proportion of the deaths caused by air pollution in general. Almost half of the deaths of air pollution are caused by exposure at the household level, which is very frustrating because normally at the house level is where you feel more protected. But this is where many people around the world, almost half of the world population, are still using very pollutant fuels for cooking, heating, or lightening their house. And this is because of the poverty. It's not a choice, obviously, it's because they don't have other means to do it. So addressing the issue of the fuels that people use for cooking or lightening or heating the house and making sure that they have cleaner fuels and again, solar or even LPG in many houses in the case of India. This has to scale up and then help households to move into a very quick way to modern and sustainable and clean sources of energy at the household level to tackle the causes of indoor air pollution, which in many cases, indoor air pollution is as well contributing to outdoor air pollution because that pollution will affect as well the outdoor.
But why do you think it's not much talked about? You said there is science. I heard you on your keynote address to the Clean Air Collective in India, and you said that we have enough scientific evidence, but somehow the discussion is not there in the public forums.
It's a mystery for me because in fact, there are more than 70,000 scientific papers demonstrating the harmful effect of air pollution. There are 7 million premature deaths reminding us every year of the urgency of this issue. There are chronic diseases that are very painful and costing us a lot. There is plenty of evidence about fossil fuels representing a major challenge for public health. And still, you should see people very alerted, very concerned, and creating a massive movement. We are not yet there. I don't know whether it's because it's a silent killer. I mean, we don't touch it, we don't see it perfectly. It's because we are not doing enough efforts to inform the citizens, but we are doing as much as we can. It's never enough, of course, but or whether there are economic interests behind, and probably that will justify as well one of the reasons. But that's why we need to work on the commercial interest, because if we prove that there are other options, that you can have sustainable transport, you can have a different way of obtaining energy and electricity by using different sources of energy. You can have different industrial processes and you can still have a very healthy economy. Maybe this is the way to go around this very heavy interest, that the conflict of interest that there is at the moment behind air pollution.
Dr. Maria, one question we always get from our viewers and our readers is, what can I do as an individual kind of thing? Yes, there's a lot to be done on a policy level, on an administration level, but there are many good meaning individuals who wants to do something to clean up our environment, especially the air. So what's your message to individuals who keep asking this very potent question, that what can I do to help clean up my air, clean up my environment?
Be an activist. I mean, any of us, we can spread the word, keep talking about, keep putting pressure on your politicians, whether it's at the highest level or it's your mayor or it's your municipal responsible or your little group or your family. So keep putting pressure, keep talking about, and then do your own work. Means be a kind of sensible citizen and responsible one. Recycle, don't take your car if it's not needed, and take the public transport, and try to push for a better one. Be very conscious of the use of the energy, energy efficiency, and be as well at home. Try to have an environment where you don't abuse of all of these sources of energy that we have around. So be a conscious citizen, don't pollute, and try to have your own individual strategy for reducing your own pollution, and then spread the word to others and keep voting. Your vote is the most powerful strategy and tool that you have, so use it properly.
My last question to you. You have traveled the world, you have served in many countries, especially in the developing countries like India. We have the air is toxic, the water is polluted, the soil is equally polluted. Is there a hope? And how can we turn it around from your vast experience?
I mean, India is an incredible country. You have the best of the technology. You have incredible engineers. You have incredible technologies. You have incredible science and scientists. Any meeting you go around the world on science, you will find an Indian expert, and no doubt. So I don't think it's a question of technology or knowledge or science or capacity in India, because you have that capacity. So there is hope, of course. I am very, maybe naively optimistic, but optimistic that India will give us a big surprise and will lead a movement on the new energy sources and the new development and zero carbon soon. So maybe it's a question of finding the right click that we all need to contribute to for this paradigm shift. But the moment India will give that shift, that would be amazing, because you are an amazing I mean, you're not a continent, but almost a continent, and the influence that you can play around. So we count on the science in India to produce this paradigm shift, and the people of India will do it.
Thank you for your wisdom. I hope we'll bring in a lot of change with your words. But thank you so much, Dr. Neira, for joining us on Planet Outlook. It's a pleasure having you. You stay safe and hope to see you soon again.
Thank you so much for inviting me. A great pleasure. And please keep this role on mobilizing and doing advocacy. Thank you very much.